they're all masked, I will do this without one. The man of the hour. So first off, thank you everybody for coming out today. We'd like to welcome Governor Gavin Newsom to Clinica Sierra Vista and the Elm Community Health Center. It is a historic day here in the Central Valley. Also like to thank our legislators, Assemblymember Dr. Joaquin Arambula, Senator Marina Elena Durazo, and Senator Susan Talamantes-Eggman, and all the other dignitaries who have come out today for this moment. It means so much to all of us. We're here today because of our belief that healthcare is a right, it's not a privilege. We truly believe in our souls that healthcare is for everybody and everyone should be entitled to that. Today we're one step closer to fulfilling that promise we made with our community here nearly 50 years ago. We are grateful for the work done by our legislators to push forward on health equity in California, and today together we are addressing the inequities that our health system has in it, including expanding access to undocumented parties and giving a voice to those who have been silenced for too long. We're fighting to address poverty, healthcare disparities, and ultimately, we're advocating for basic human rights. Clinica Sierra Vista team takes care of 130,000 patients in a year through over 350,000 visits. Of those patients, approximately 30,000 are self-pay or undocumented patients in our system. Today, on this campus, over 5,500 of those patients are served here. Community health centers across the country, like Clinica, have been providing healthcare to all for over 55 years. This is a very special year at Clinica. We are celebrating our 50th anniversary, and I'm really honored, thank you. I'm really honored to be working with 1,300 healthcare heroes who have been here every day throughout the pandemic, taking care of our patients. These people that work here truly understand the importance of providing care and being there when our patients need us the most. Today, we are honored to host this tour and press conference and to be a part of this big step forward in creating a better and brighter and really healthier future for all of our Californians. So, thank you. I'll turn it over to Mayor Dyer.
Well, thank you very, very much, Stacy, and thank you for hosting us here. I also want to extend a warm welcome to our governor for choosing Fresno for this very special day. And it is a special day, and so thank you for doing that. And also a special thanks to Assemblymember Joaquin Arambula for his efforts, as well as the other senators on the committee who made this a reality. And one thing that we've learned from the pandemic this last year is the importance of healthcare providers. Healthcare providers like we see right here at Clinica Sierra Vista. And we want to say a special thank you to them for all the work that they've done. They have stood in the gap over this last year and well beyond that in serving our underserved populations. And we want to say thank you, Stacy, for you and all of your folks for doing that. We also learned this last year that there are certain populations that are much more vulnerable than others and susceptible to illness, susceptible to the virus. And I believe that COVID-19 really put a spotlight on that for all of us to see this last year. Everyone is entitled to be healthy, and I really honestly believe that. And oftentimes those vulnerable populations do not have access to health care for a variety of reasons. And this bill today that is going to be signed is going to be one step closer in making that happen. Health care is a basic need, one we often take for granted. And that is the driving force behind Assembly Bill 133, making sure that the basic needs of Californians are met, especially in our underserved population. It's also the importance of everyone getting the vaccine. We want to reemphasize that time and time again. I'm encouraged by the fact in Fresno County last week, we had 11,500 people be vaccinated. We are now at 50. We are now in Fresno County at 56.4% of our eligible population. Those are 12 and older, and 86% of our population that is 65 and older have been vaccinated in Fresno County. But we have so much more work to do. We have got to get those numbers up, and thank you to Clinica Sierra Vista for all you do to make sure we're getting the vaccines. Thank you to the governor for what you put in motion this last week at the state, and I believe we're going to see local governments follow suit very, very quickly. And so with that, I want to introduce Jose Torres Casillas, and he is from Health Access. Jose?
All right, thank you, Mayor, and good morning. Buenos dias, buenas tardes. My name is Jose Torres Casillas, Policy Advocate with Health Access California, the statewide healthcare consumer advocacy coalition. We are a proud co-chair, along with the California Immigrant Policy Center, of the Health for All campaign to ensure access to Medi-Cal for all Californians, regardless of immigration status. Along with the nearly 100 organizations that are a part of the Health for All coalition, we are thrilled to be here witnessing history. With the signing of AB 133 today, California will move closer than ever to universal health coverage. These first-in-the-nation investments will expand healthcare to hundreds of thousands of Californians and improve our health system for all who call California home. Since 2013, advocates have pushed to end harmful exclusions in Medi-Cal for undocumented Californians. In 2016, California expanded Medi-Cal to all children, and 2 years ago, Governor Newsom led California in becoming the first state to expand Medi-Cal to young adults as well. Now, today we are here proud to stand alongside the governor as well as our legislative champions, Senator Durazo and Assemblymember Arambula, as we continue to lead the nation in the march towards universal coverage by removing the exclusion in Medi-Cal for undocumented Californians over the age of 50. This means that people like my tios, my tias, mis abuelos, they can go and access a primary care doctor, that they can get treated for the variety of chronic conditions that they may be experiencing as they're getting older now, or and see about any other issues that may have been exacerbated by the pandemic. AB 133 makes major investments in improving the Medi-Cal program as well, so that all who now have access can get the care that they need. This includes removing the Medi-Cal asset test, expanding doula services, and continuing CalAIM reforms. On behalf of Health Access California, the Health for All Coalition, and healthcare consumers, we are thankful for these major steps toward a more equitable and inclusive health system. Today, we celebrate these victories for California's health and commit to continuing to improve our health system to create a true California for all. And so next up, I would love to introduce my colleague Beatriz Hernandez with the California Immigrant Policy Center.
Hi everyone, my name is Beatriz Hernandez with the California Immigrant Policy Center. As I stand here, I'm full of emotions to represent my undocumented community, Health Access, and the California Immigrant Policy Center, and all advocates and organizers who made this possible today. I'm out of words, to be quite honest. I am undocumented and I know what it's like to not have access to health care. I benefited from the expansion of young adults to get access to health care, and I want that for everyone, for all Californians, regardless of where they were born. It is such happiness, and I'm here to thank Governor Newsom and everyone here today who made this possible. And to all of you watching at home, know that this is the right thing to do, especially now as we're all dealing with the pandemic and losing loved ones. We all need this access to healthcare now and when we recover from the pandemic. It doesn't matter the color of our skin or where we were born. We all deserve this, and we all contribute to the social fabric of this state. So I want to say thank you y un saludo y mucho amor para toda mi gente del Valle Central, a todos los campesinos y toda la gente que trabaja día y noche, aportando y dando a esta economía, a este estado, porque sin ellos pues no estuviéramos aquí, ¿verdad? Entonces muchísimas gracias, and yeah, that's all I have to say. Thank you. Now I would like to introduce Senator Eggman.
Good afternoon, everybody. I am very honored to be here in this clinic with all of you. I'm just standing here reflecting. I have worked in and around healthcare since I joined the United States military at the age of 18 and was a medic, and have worked way more years than I'd like to admit in and around healthcare. And this year when I went to the Senate and was able to become the chair of the budget health on Health and Human Services, it was like a dream come true. And I know I speak for my colleague Joaquin Arambula as well, who's also worked in the healthcare. And when we started this year, thinking that was going to be a terrible budget year, and then when we were able to see that the very wealthy did very, very well, very, very well, and it shows by the excess of money that we're able to have. So what better use of all of that money of people who have done very well than to help those who helped them do so well? And so we not only are able to expand access, but we've been able to expand what is provided. In public health, we're putting a lot more money. In mental health, I'm a social worker. In mental health, huge amount. We know the trauma that people have incurred. We know the stress that people have been under. We know mental health as just as important. We've worked on telehealth, so you don't have to drive all day. And I still have a bill that hopefully we can do 2 billings on one day for both medical and mental health care. But then to be able to provide expanded health care, really to be able to do good work, and then to expand it to those who had no access. That was our goal this year. We're glad the governor partnered with us. The Latino Caucus, I'm proud to be a member of. That was one of our priorities, and I know Dr. Arambula and I both pushed on our sides. So it was a combined effort, but really it's your stories, the stories we've heard. And through the pandemic, we have seen so many of our essential workers are brown skin. So many of our essential workers are even from our API community as well, who are undocumented folks who didn't have access, but were out there in the front lines so we could still eat and so we could still survive. So to be able to cover as many people as possible is one more step to really fulfilling the dream for all of us. So I want to thank the governor, I want to thank the leadership in the Senate, my colleagues up here, all the advocates, and then introduce my colleague, my friend, Dr. Joaquin Arambula.
Now, it's hard to summarize all the work that you've done for 6 months in 6 minutes, and I will make sure not to talk for 6 minutes today, as I'm sure many of us want to hear from Governor Newsom and see him sign AB 133. But there's a fair amount that we have not spoke about that is within this bill that needs to be addressed and love to follow up. Whether or not that's California leading the way with the Children's and Youth Behavioral Health Initiative, which will allow our children to receive resources and benefit after going through this pandemic of the century. Whether or not it's the California Advancing and Innovating Medi-Cal, a innovative program that will focus on population health, on enhanced care management, and in lieu of services, ways in which we can improve the very system that a third of all Californians rely on. The programs that are also in here to help us to expand workforce, as in the Health Profession Career Opportunity Programs, that will allow thousands of students to be able to enter into a health career field after this pandemic of the century, is something that we need to highlight today. But I'd like to talk about, if I can, the importance of increasing access to health care, as it has been a major driving force for me leaving my career field practicing medicine. But it was seeing those inequities firsthand that led me to running for office in the first place. What happens to our essential workers, to our frontline workers, to our ag workers who are working in packing houses, to those who are taking care of us within our health facilities, to those who help to put food on every one of our tables. We have seen how they have helped to keep our economy going and essential to our state being functioning during this pandemic. But it's those same workers who bore the brunt during this pandemic. It was those same people who suffered the worst consequences, and it is why it is so important that in this budget we are doubling down and investing in those same communities. It is our immigrant brothers and sisters, our communities of color, who are going to benefit from this increase in access. It's going to be our elders and seniors, our income eligible uncles, aunts, grandparents, our families who will benefit from this investment and increase in access. But it does not go without advocacy for years. From groups like Health Access to the California Immigrant Policy Center to great legislators like our champion, Senator Durazo and Senator Eggman, as well as our tremendous leadership with Pro Tem Atkins and my speaker, Anthony Rendon. But none of this is possible without our governor, Gavin Newsom, and the great state of California continuing to invest in all Californians. I will say how important it is to increase this access, but I believe those who will benefit will speak more about what it means to them. As a representative for the Central Valley, where I have the honor and privilege of representing many people who contribute and pay taxes but can't always benefit from the health care systems they pay into, today they can. It is for those elders and seniors who have been paying taxes for years that we will now be able to provide health care coverage, and this is a day we should celebrate. This is a day we should be excited and recognize that our government is working for the people, and I am so pleased to be doing the people's work. Thank you for allowing me to share what is within AB 133, but I would be remiss as a physician not to also uplift the importance that our vaccines play right now. They are our best protection and defense against COVID-19 and the variants like Delta that is going through our communities right now. It is important for everyone, regardless of immigration status, to receive vaccinations and wants to make sure to encourage everyone to come out and do that. Now, without further ado, I would like to introduce my friend, my colleague, our champion, Senator Maria Elena Durazo.
Thank you very much. Buenos días. Todavía son buenos días. Yo soy senadora María Elena Durazo, representando al área de Los Ángeles Central y el Este. I'm Maria Elena Durazo, representing East and Central Los Angeles in the 24th District. And as my colleague said, I want to acknowledge him, Assemblymember Arambula, Senator Eggman, our legislative leadership, President Pro Tem Atkins, Speaker of the Assembly Rendon, the Latino Legislative Caucus, advocates, supporters, activists. Congratulations to everyone for your hard work in raising this issue. Today we stand and we are proud to be Californians. Governor, we are proud of what we have accomplished together. You have combined humanity and reality, pragmatism and idealism, and a good heart with great courage. Through all of your efforts, we have seen California first expand to cover approximately 250,000 children and young adults. And now, today, approximately 250,000 more Californians, 50 and over, will also receive basic health care. This is an important day to celebrate. It's a milestone for our Health for All movement, especially in the wake of this global pandemic. The cost of doing nothing is far greater than the cost of providing coverage. People suffer, and people lose their lives. Our healthcare system works best when all Californians have access to preventative treatment. Too many states have made healthcare impossible for immigrants to get. Now, those very same states are making it harder for people of color to vote. California is better than that. And I stand with you, Governor Newsom, as a proud Californian. Thank you very much. Solo quiero decir unas cuantas palabras que hoy nuestro gobernador demuestra un buen corazón y gran valor. Al firmar la ley hoy, 250,000 adultos de 50 años o más de bajos recursos son elegibles para seguro médico. En la mayoría de los estados en esta nación es imposible que inmigrantes tengan derecho a seguro médico. No es así en California. En California hay más respeto por los inmigrantes. Por eso soy una californiana orgullosa. And without friends, neighbors, colleagues, I introduce to you today, as a proud Californian, our great governor, Gavin Newsom, who is a governor for all Californians. Doesn't matter if you're a Dodger or Giant fan. Thank you very much.
Well done. We're bringing her up. Thank you, Senator, and thank you for not only your leadership, but your passion. As they say, passion persuades, and I want to just thank you in particular, Senator Eggman, Dr. Rambla, for your incredible, steadfast leadership. We would simply not be here today without you, and years of advocacy, not just in their respective roles today, but in their previous roles. These have been champions. These three leaders have been champions in getting us to this point today. We recognize we're just at a point on a journey to universal health care here in the state of California. We have not finished that job, but we're making a big investment here today in that progress. Jose was absolutely right. We initiated, I think at the time was Senator Lara, now our insurance commissioner, that initiated in 2016 coverage to everybody up to the age of 18. I was pleased to be governor and have the privilege and opportunity with the incredible support of the leaders behind me to initiate a process that was not only embraced but was expected of our budget in 2020 to expand eligibility up to the age of 26. Today, we're doing it for everybody age 50 and older. As Senator Durazo said, rightly said, roughly 250,000 people are eligible for coverage. We estimate at the moment about 235,000 individuals will be direct beneficiaries of preventative care, direct beneficiaries of long-term care, direct beneficiaries of in-home supportive services and the care that IHSS provides, regardless, again, of their ability to pay, regardless of their pre-existing conditions, and regardless of their immigration status. It's a point of pride, it's a point of principle, and it's what marks our values here in the state of California, a universal state, the most diverse state in the world's most diverse democracy. And we believe in living together and advancing and prospering together across every conceivable difference. And with that in mind, let me acknowledge the leadership of your mayor. Mr. Mayor, thank you for being here. It means a lot. Now, it doesn't surprise me because I've watched this mayor up close in Fresno. We had an opportunity last week to talk about the issue of crime and justice in the state of California. We had the privilege of working together on some homeless issues, and I've seen this mayor up close, and he's a pragmatist. He wants to get things done. He's not into pointing fingers, explaining away the world around us. He actually wants to make progress. And so, Mr. Mayor, I think it means a great deal that you are here at this momentous occasion. And so let me just personally express that gratitude, but also professionally thank you for recognizing this moment as well. To Beatrice, thank you for putting a human face on this issue as well, and reminding us of the Commonwealth, reminding us of the universal nature that is this state, and the fact that we're all in this together. And I appreciate all your incredible advocacy. And Jose, thank you. You guys, we wouldn't be here without you as well. It's that dialectic between people in positions, Senate, Assembly, governors, mayors, but those with moral authority, like the two of you, that push the envelope and raise the bar of expectation. And we're grateful to both of you for your leadership as well. Stacy, this is an amazing clinic, and it's one of many all throughout our state, particularly here in Central Valley. Thank you for what you're doing. I had the privilege of walking around this clinic with Stacy to meet some of the frontline employees, many of you behind these cameras. Thank you for your incredible work. Thank you for reminding me when we walked in there that it's not just about dollars and cents. It's not about ABs and SBs. It's not about bills, trailer bills, or other kinds of bills. It's really about impacting other people's lives, and you do that each and every day. And so I want to just thank you for the incredible work you're doing here in Fresno and throughout the Central Valley. Let me just, as briefly as I possibly can, and Dr. Rambla did just a spectacular job summing up a complex bill, because this has many components. Of course, it has the expansion of health care regardless of immigration status to everybody over the age of 50, but there are other critical components, and it was referenced a moment ago, and it's incredibly important. I believe Senator Engman also reminded us that there is an important component of this bill, $4.3 billion, $4.3 billion to provide comprehensive universal screening for mental health for every child aged 0 to 25. This is the biggest investment this state has ever made in this space for support, screening, and services. The most comprehensive investment to really focus on brain health in a detailed, culturally competent, bottom-up way. That is a second component of this important piece of legislation. A third important component is $2.2 billion of a $3 billion commitment the state is making to rebuild mental health housing and infrastructure. The great dismantling that began in the 1960s and 1970s, not only here in the state but across this country, that great dismantling has led in many respects to the conditions that we are experiencing here today. And this commitment in this budget is the largest investment in board and care, opportunities to provide housing for those that are conserved, placements for those under Laura's Law, and that is also a critical component of this bill that we're signing here today. Jose, I love you talk about douala services. I mean, I never heard a young man, I mean, that's just, I love that. My wife was smiling. She's not with us, but I promise you, she was smiling when you said it. Postpartum services are also part of this. And you don't have to get a mental health screening. It was 60 days under this expansion. It's now covered for a full year. In addition to that, and Stacey, you understand the telehealth. We were talking about that a moment ago. The legislature and their wisdom, thank you again, Senator, others, for their legislative leadership. We're going to extend the telehealth opportunities through 2022, another critical component of this legislation as well. And so I can go on. I'm past my 6 minutes that Dr. Ramala placed as a cap, but I'm here just with pride and privilege. The pride in being able to sign a bill as impactful on real people's lives as this bill is, and the privilege to be able to do it as your governor. So with no further ado, let's start with the most important part of why we came here today, and that's the pen and paper. You got to get up here. I know you got to get up here for this signing. And let me, you all gathered around. We'll get this. You read all this? This is you carry that part, and I'll just do the final part. It's 4 sections. To wit my point, this covers a lot. And by the way, this is the last bill signing of this, well, record-breaking budget. Record-breaking reserves, record-breaking surplus, record-breaking investments to address some of the pre-existing and systemic challenges the state has faced in historic ways. This, perhaps one of the more important of these trailer bills. With that, we're honored and proud to sign this bill. Doctor, thank you very much. That's your pen. Thank you, guys. What do you think? Pretty easy, huh? Is this it? That was it. This is the. I read every single adverb in these bills. With that, I have my spokesperson who's here to answer any questions. You ready? All right. That's why you came. You told me that you were ready. We're here to answer any questions. And if there are no questions, we'll just thank you all for.
Hi, Governor. Dale Urong from ABC 30. The CDC today will issue a revision to its mask-wearing guidance. The CDC will recommend that people, even if they've had the vaccination, they should wear masks indoors in areas of high COVID transmission rates. Governor, what are your thoughts on the CDC revision, and how might it impact future mask-wearing guidance here in California?
Well, we've been working hand in glove with the CDC, or face to mask with the CDC for some time. I'm looking forward to the details, and as soon as we avail ourselves to the details, some of the tiering strategies, which we've been in dialogue with the CDC on, we'll make some comments in very short order. But I want the the benefit of actually reading the details before the state comes out with a guideline. But in anticipation, you know, California has been leading one of the first states to require mask coverings and wearing for in-person instruction in the fall for all of our kids, so we can get them safely back into school. It seems the CDC is aligning with that, as the American Pediatric Association has as well. But we'll be taking a good look at it, and within the next number of hours, be putting out a statement.
Hi, Hi, Governor Jocelyn here with CBS 47. Two quick questions. One on this specifically, if you could talk specifically when this goes into effect and exactly how this pandemic highlighted the need for this. And then the second question, just as you're announcing this, I wanted to see if we could get your reaction to two recent polls that showed support for the recall has grown, and how do you hope to gain more support now weeks before ballots go out?
So as it relates to the application implementation, there are many different components in this legislation. Again, you saw the stack here. And so the implementations are from the next number of months to the next 5 years, depending on the component of what is in here, meaning telehealth versus the expansion of coverage 50 plus, which implements around May 1st, 2022, and then becomes fully effective over the course of years. It scales from $48 million annual contribution to, well, about $1.3 billion when it's fully implemented. So it's a process that takes shape over the course of the next number of years across the spectrum of these supports. As it relates to your question, we're going to defeat this partisan effort, and we're going to work hard to do the work that people sent us here to do, to address these vaccine issues and the health disparities that have been exposed in this pandemic, to address the issues of homelessness and the cost of housing, to improve the quality of life for 40 million Californians strong, regardless of their political identity, regardless of their geography. We're going to have the backs of rural Californians. I was here, by the way, just a week or so ago, signing an unprecedented landmark commitment, $6 billion for broadband, the middle and last mile, the biggest investment in U.S. history at the state level to address those digital divides. Continue to do that good work. I think we're going to be okay on Election Day, September 14th.
Good morning, Governor. Thaddeus Miller, Fresno Bee. So we heard yesterday the announcement that certain state and health workers will be required to get vaccinations. Where are you on expanding that mandate to a greater amount of the population?
Well, what we did yesterday was significant. No other state has done what California did. We not only did it for 246,000 state workers, but roughly 2.2 million additional healthcare workers were part of this overall announcement. We have partnerships from clinics, hospital system. You saw statements yesterday. We're very grateful for the statements that came out, California Medical Association and others that were supportive of these mask verification and or testing requirements. You also, I hope, noted that many cities, many mayors announced publicly. A number of them have reached out privately and are ready to soon make similar announcements, as well as many representatives in the private sector. You saw over 300 bars, just as an example, in the Bay Area that announced a similar strategy independent of the state's action. Obviously, with the CDC's action on masking and the growing anxiety around this Delta variant, 5.4% positivity today. 5 weeks ago it was about 0.7%, plus or minus 5 weeks, gives you a sense of how quickly it's moved. Over 3,200 now people hospitalized, was less than 900 in the middle of June. Gives you a sense of the urgency of this moment and the imperative and importance of people getting vaccinated. Final point, and Dr. Rambo made it, as did the mayor. It is incredibly important to do two things at once. One is to thank the millions and millions of Californians that have gotten vaccinated. Because of your work, we're doing better than vast majority of states in this country. Let me be specific. 10.4% positivity rate, or excuse me, case rate in California. It's 49 in Florida. It's 10.4 in California, 49 in Florida. And I think that's substantially driven by the fact that roughly 75% of all eligible Californians have received at least one dose. So that's the good news. But the bad news is there are about 25% of folks that are eligible today that can go to a clinic like this, no cost, regardless of their immigration status, no cost, and avail themselves to that same life-saving vaccine, but for whatever reason haven't done it. Now, I met a young lady a moment ago who was very candid with me. She says, I'm in here today to get vaccinated because I had a family member that got sick. And that's what it took for her, and I respect that. She otherwise was not necessarily that enthusiastic to get this life-saving vaccine, but now she realizes it's not just about her. These are her words. She says it's about her family now and protecting them. And so we're mindful that there are a lot of people that are still anxious, a lot of people that still need to work with doctors in private settings to work through those anxieties. But we also recognize there are a lot of people that have been misled by misinformation. And we've got to call out the misinformation campaigns. We've got to call out those that are knowingly misleading the public. And we minced no words on that yesterday, and we'll continue to be very targeted and focused on those misinformation efforts.
Hi, Governor. Rich Rodriguez from Fox 26. Along vaccinations, we've been around this vaccination thing for 8 months for COVID, and you've tried everything. You've had incentives, big and small. We've seen long lines go to 5-minute inconveniences. So is there going to be a time when you just finally say, some people just don't want a vaccination?
Yeah.
Will you throw in the towel, or is this going to be something that you just won't give up?
We're never going to give up. Absolutely. We're going to meet people where they are. We're going to, if the answer is no, you ask a better question. You got to keep at it. Let me give you some specifics. We're not, by any stretch of the imagination, throwing our hands up. Let me give you specifics what we've just done the last week. We're investing $40 million with the support of the legislative leaders you see behind me to work with primary care physicians, small family doctors, to provide grants so those trusted messengers, truly trusted messengers, can work through those anxieties of individuals. That's a new program, and those dollars are going out in real time. We put now 480 community-based organizations to work, 400 ethnic media partners to work. We have barbershop programs. We have faith-based programs. We've taken static sites to make them mobile sites. We are quite literally doing phone banking to the tune of 1.3 million conversations that 70 CBOs have had through a GOTV program, Get Out the Vax program. We're providing more opportunities, not only at community clinics like this, but at school sites and encouraging employers to do the same. You're right. We did incentives, and it looked like the incentives worked. California may have outperformed the rest of the nation. Some of the incentive programs may not have worked as effectively, but we saw a reduction in the rate of decline of vaccinations when we put those incentives to play, and we actually saw a modest increase week over week at the peak of those prizes. So we'll continue to push hard at this, continue to push back against the misinformation. We have a whole team at the Department of Public Health that actually has a misinformation dashboard and newsletter that they put out, and an email hotline that they have around misinformation, and they can counter it with trusted messengers. We have video Q&As that we put out in a very culturally competent way, and we are in every part of the state, not just in large urban settings, but all throughout the state, in rural and even very remote parts of the state where we still have a lot of work to do.
Hi, Governor. This is Sarith from Valley Public Radio. You talk about homelessness a lot in your efforts, and I'd like to know, are they benefiting from the mental health screenings that you just spoke about, or the mental health housing? How will that roll out, and how much money is the state planning to invest to meet all the components of this bill?
$12 billion. The homeless commitment is unprecedented in U.S. history. California's largest investment to address the issue of homelessness was $950 million. We were able to do that together last year despite the economic contraction, despite a budgetary deficit. This year, we're investing over the next few years $12 billion, $6 billion into our successful home key model. And I just want to again applaud the mayor, who just quickly drove efforts to procure and acquire hotels and motels and get people off the street in real time. That sense of urgency is what I believe the taxpayers expect. We are not interested in 5 to 10 year plans when we have strategies now that can produce more immediate results. And so we are taking the program that provided 6,000 units last year, $849 million investment, and putting $6 billion, 5.8 to be exact, in this budget to help build on that program and provide even more flexibility for the type of housing that the mayor here in Fresno and other parts of the state can procure. We're also looking comprehensively at the issue, again, of behavioral health. These dollars now will begin to be invested. We're looking at matching strategies and grants with local and regional partners. We're supporting our entire healthcare delivery system at record levels. And it was noted a moment ago, and I was remiss, one of the most significant things that was a part of this component package is something called CalAIM. Dr. Rambla referenced it. CalAIM is a once-in-a-generation opportunity to completely transform the Medicaid system in California. We refer to it as Medi-Cal. And it's the integration, and this goes to your question, of physical and brain health, the social determinants of health, or what is referred to in the world Stacy lives in, whole person care, looking more comprehensively at the individual in a much more comprehensive strategy to address needs, not just housing needs, not just mental health needs, not just substance abuse needs or physical health needs, but the integration of strategies. And that's a new approach in California, and one we're very enthusiastic about implementing over the course of the next few years.
Governor Maria Ortiz Briones with Vida en el Valle in Fresno. How does the state plans to continue to address the vaccine deserts that are largely in rural areas like in the Central Valley, but they also have large Latino communities?
Well, we'll continue to do more to partner with community-based organizations. I noted the 480 now that not only we partnered with, we extended contracts for, the additional outreach that we are targeting specifically to farm workers, specifically in more remote parts of the state. The GeoTV program and the phone banking is done in many different languages as an effort to reach out and meet people where they are and address people's anxieties. I'll just be specific to this area. We have 20 CBO partnerships just in this immediate region. We have done 83,000 referrals. This is brand new information I got last night, just in this region, referring people to clinics like this to get vaccinated. We're going to double down on all of those efforts, recognizing good enough never is, and recognizing the incredible power and potency of individuals like that young lady that I met today, of going back home and into her community saying that I got vaccinated. I feel great, I feel healthy, and I feel now more empowered. And that power of example perhaps is the most important message, and she's perhaps the most important messenger that we also need to encourage in order to get to herd immunity ultimately, to get this pandemic behind us. With that, let me thank you all. Let me thank in particular all of those that patiently waited behind me. Again, Mr. Mayor, thank you for the privilege of your time, and thank you, Stacy, for availing all of us to this remarkable clinic, and to each and every one of the remarkable two senators and the assembly member. Thank you. You made this happen. We're proud of you, and quite literally, millions of lives are being improved because of your leadership. Thank you all very, very much.